Hey everyone, it's Vesterverse, and today we're going to discuss approach to chest pain. Let's say a patient presented to the ER with chest pain. What would you do, and how would you approach this case? So I'm going to tell you in this lecture how can you simply approach such a situation. First, you're going to start with inspection. You're going to look at the patient's skin. Does the patient has any lacerations, burns, bites, or even shingles? And as we know, shingles is caused by herpes simplex virus. Subcutaneous, again, there's nothing mysterious about this, just like the skin. We're going to check if the patient has cellulitis, if the patient has abscess. Both of these are reddish erythematous lesions, and in abscess, you're going to see more like a lump. Third, for the musculoskeletal system, we're going to check if the patient has any sprains or strains. A sprain is a pain in the ligament. A strain is pain in the muscle or the tendon. So also we're going to check if the patient has any fractures. And one of the most important things among this category is costochondritis. Costochondritis is the most common cause of chest pain, especially in young, otherwise healthy patients. So this is an important thing to keep in mind. For the lungs, or technically the pleura, when you look at the lungs, so you have a problem with the parenchyma, you're not going to sense the pain. Unless the problem goes all the way to the pleura, you're going to start feeling the pain here. So what would you think of in such a situation? What could be the problem in the lungs or in the pleura that is causing pain? Pneumothorax, pneumonia, pulmonary embolism, and pulmonary cancer. And again, the pulmonary cancer, usually when we find out about this cancer, it's already too late. It's advanced because the parenchyma itself has no pain, not unless the tumor is going to grow so big that it also affects the pleura that the patient starts to feel the pain. Fifth, the pericardium. Pericardium is the layer that is surrounding the heart. And in this situation, we specifically have pericarditis. We have tons of causes of pericarditis, including cancer, rheumatologic diseases such as systemic lupus erythematosus, infections, and trauma. Then we check for the heart. We checked the pericardium, now we look at the heart. When you look at the heart, the most important thing that you want to look for is myocardial infarction or acute coronary syndrome. But sometimes it could be an infection leading to myositis. In rare cases, the patients may have aortic dissection or aneurysm, but in this situation, it's kind of obvious because the pain due to aortic dissection is so severe that the whole hospital is going to hear this patient screaming. The esophagus. Patient could present with GERD, gastroesophageal reflux disease. This is when the acids from the stomach go all the way up to the esophagus, causing a heartburn. The pain could be due to esophagitis, and there are tons of causes of esophagitis, or a perforation. The most common cause here is ulcers. When we suspect esophageal cause of chest pain, we can give the patient something called gastrointestinal cocktail. This is composed of anesthetic, anticholinergic, and antacid. Antacid helps in GERD. Anticholinergic helps in esophageal spasm. It relaxes the muscles. And anesthetic it's technically local anesthesia. As soon as we see a patient with chest pain in the ER, we're going to do three main things. We're going to order a chest x-ray, we're going to do a 12-lead EKG, and we're going to check for troponins. Especially 2 and 3, these are important to rule out acute coronary syndrome and myocardial infarction. A chest x-ray would give us a general idea about what's going on with this patient. So all these 3 together give us a good look at the chest and what's going on. Not a perfect one, but the good look to suspect something or rule out something. Alright guys, that was the end of our lecture for today. If the video was useful, don't forget to like it, subscribe to our channel, visit our website, get the free sketches, and stay tuned for more upcoming simple videos.